evening, everyone. A warm welcome to everyone for the 13th Journal Club. So in today's Journal Club session, we'll be talking about how plant-based diets can help in the management of diabetic neuropathy. So let me introduce you the speakers of today's Journal Club session. One is me, Dr. Sindhura, Dr. Preetham, Dr. Dharani, Dr. Sandhya Rani, Josna, Srinidhi, and Gayatri. So let's begin today's session with the PAN introduction. So Srinidhi, you can please take over.
Thank you, ma'am. A very good evening, everyone. Welcome you all to the 13th Journal Club. Physicians Association for Nutrition is an international organization of healthcare professionals on a mission to make nutrition a central pillar of healthcare. We believe that evidence-based nutrition is a key to preventing and treating chronic diseases, promoting a healthy planet, and creating a more sustainable food system. We also facilitate the seamless integration of evidence-based nutrition intervention into mainstream healthcare, and we provide comprehensive resources and training programs to ensure doctors, nurses, and other healthcare providers are equipped to guide patients on optimal nutrition for good health and disease prevention. PAN advocates for policies and strategies that create a healthy and sustainable food system accessible to all. We also foster international collaboration among medical professionals. We believe by sharing knowledge and best practices, we can create a global movement towards nutrition-centered healthcare. By focusing on these core activities, PAN aims to transform healthcare delivery and empower individuals to take charge of their own health through evidence-based nutrition. Next slide, ma'am. So this is our esteemed leadership board, Dr. Alan Korenberg, Dr. Nicholas, and we are fortunate to have Dr. Rajina Shaheen, ma'am, our medical director. Her tireless efforts and strategic vision have been instrumental in advancing PAN India's mission. PAN team boasts a very strong structure built on the contributions of medical professionals, doctors, nutritionists, and other healthcare providers collaborate as program managers, ambassadors, and volunteers, forming the backbone of our organization. We also engage with our dynamic international team who are actively involved at various capacities. So, are you a doctor, a medical student, or a healthcare professional passionate about nutrition? Team PAN India welcomes you. We encourage you to join us as ambassadors, volunteers, or in any capacity that aligns with your expertise. Together, we can make a significant impact on integrating evidence-based nutrition into mainstream healthcare across India. So without any further ado, let's dive deeper into today's insightful research, plant-based diet and diabetic neuropathy, a systematic review. I request Dr. Dharani ma'am to take over.
Hello, everyone. Today, let's just see about the diabetic neuropathy and how does that occur. So let me just give a quick introduction about what is diabetic neuropathy. So when there is an uncontrolled blood sugars or when there is so much of glycation, there is so much of oxidation and it can cause microvascular damage, and thereby the nerves can also damage, the nerves shrivel when blood vessels disappear. Next slide, please. And these are the symptoms of diabetic neuropathy. It can be pins and needles, burning, tingling, painful cold, or electric shock-like symptoms. And there are different types of diabetic neuropathy. This is a typical glove and stalk appearance, that is peripheral neuropathy. And other type is autonomic neuropathy, and the other type is focal and proximal. In autonomic neuropathy, it can manifest as different symptoms, hypotension, cardiovascular dysfunction like hypotension, gastric dysfunction like indigestion, gastroparesis, and constipation, urinary dysfunction. There are so many. Next slide, please. Like we discussed, it's gastroparesis. And next slide. And this is the focal thing. There can be a single nerve damage like carpal tunnel syndrome, in which the medial nerve damages and the symptoms of tingling and numbness can present. Next slide, please. And these are the factors that can happen and worsen diabetic neuropathy, like mechanical compression, like we discussed, carpal tunnel syndrome, and microvascular damage, like in autonomic nervous system. Stability increases the worsening of diabetic neuropathy, obesity, duration of how long the diabetes is present in the patient, and uncontrolled diabetes and high levels of fat, unhealthy lifestyle, high blood sugars, autoimmune. Next slide, please. So, what is the treatment of diabetic peripheral neuropathy? There are multiple studies and multiple approaches to cure or reduce the symptoms of diabetic peripheral neuropathy. One of the potential approach to reduce the neuropathic pain is one of the approach is whole food plant-based diet or vegan diet. And yeah, there is a study going on, crane and sample reported regression of neuropathic pain in patients, in which they have studied with 25-day lifestyle enhancement program comprising of vegan diet, exercise, and supplemental factors. Approximately 80% of the participants reported complete relief of neuropathic pain within just 4 to 16 days. And here we would like to correlate between whole food plant-based diet and symptoms of peripheral neuropathy, diabetic peripheral neuropathy, and take over to the, yeah.
So, good evening, everyone. Today I'll be talking about the methodology of the particular study. So, next slide, please. So, the study type was a systemic review, and the population concerned were patients with type 2 diabetes aged 18 years or older suffering from diabetic polyneuropathy. The intervention or exposure that we looked for was dietary modification towards either a whole food plant-based diet or a vegan or a vegetarian diet. And comparison, even if there's no changes in diet or no dietary modification, the studies with the control group or without a control group were included. And the outcome was pain or other symptoms of diabetic polyneuropathy. The study design was a prospective observational study, which included randomized, both controlled and uncontrolled, like I said, and case reports and case series published in peer-reviewed journals. Next slide, please. So the electronic databases of PubMed and Google Scholar were used, and searched using studies were searched using keywords such as plant-based, vegetarian, vegan, diet, and diabetic neuropathy. And studies published between 1990 and through 2020 were included. Only English language articles were considered. Articles including original articles, review articles, and case report series were screened. And the studies were also included in case the dietary component was paired with another lifestyle modification like exercise. And the studies including non-plant-based dietary interventions were excluded. And lifestyle intervention studies that did not describe their dietary component in sufficient detail to ensure a vegetarian or vegan character were also excluded. Next slide, please. So as according to this flowchart, in total, 1,613 articles were retrieved from the two databases, and additional 7 records were found by scanning the reference lists of these articles. Then, using the reference management software Zotero, a total of 52 duplicate records were identified and removed. Then, from the remaining 1,568 articles, 1,509 records were again excluded, assessing the abstract and title based on the predefined eligibility criteria. And finally, 59 full-length text articles were analyzed, and predefined quality criteria were applied. And after further assessment, another 56 articles were excluded from this review. So now moving on to the results.
Let us now look into the results of the study. So firstly, this systematic review includes findings from 3 significant studies. First is Crane and Sample study in 1994, which was an uncontrolled intervention study. Next is a randomized controlled trial by Bernard et al. In 2015. And lastly, McCoy-Smith case report, which was done in 2019. These studies offer valuable insights into the effectiveness of dietary modifications in managing diabetic neuropathy. Next slide, please. First, let us discuss about Crane and Sample study conducted in 1994. This study involved 21 adults with type 2 diabetes and painful neuropathy. The subjects were predominantly obese and also had other comorbidities. The intervention was a 25-day program that included a calorie-restricted vegan diet, daily brisk walking, and supplemental lifestyle changes. Next slide, please. The outcomes were quite remarkable, with over 80% of the participants reporting complete pain relief within 16 days. There were significant improvements in glycemic control, with a 54% average reduction in insulin and hypoglycemic agents. Participants also experienced an average weight loss of 4.9 kg, along with improved blood pressure and lipid levels. The long-term effect of the program were also impressive. At 1 to 4 years follow-up, over 70% of the participants who continued the program, with the majority showing further health improvements in terms of their glycemic index and blood pressure. Next slide, please. Next, we have the study by Bunner et al. In 2015. This study included 34 individuals aged from 18 to 65 who were suffering from type 2 diabetes and painful diabetic neuropathy. Participants were randomized into an intervention group and a control group. The intervention group received a low-fat plant-based diet and nutrition counseling, while the control group took with vitamin B12 without any dietary changes. The intervention details are as follows: a low-fat vegan diet limiting daily fat to 20 to 30 grams and focusing on low glycemic index food, daily intake of 1,000 micrograms of methylcobalamin, and weekly classes on nutrition and social support were also conducted to enhance their adherence. Next slide, please. The outcomes of the study were also highly significant. The pain scores on the short form McGill pain questionnaire showed a significant reduction in the intervention group, with a decrease of 9.1 points compared to 0.9 in the control group. And neuropathy symptoms improved with the intervention group. The intervention group also lost an average of 7 kgs and showed improved in cholesterol levels. And the HbA1c level also decreased by 0.8% in the intervention group, indicating better glucose tolerance. Additionally, the study also noted improved electrochemical skin conductance in the foot among the intervention group, suggesting potential benefits of nerve function. Next slide, please. Lastly, we have a case report of a 51-year-old woman with uncontrolled hypertension, pulmonary hypertension, and type 2 diabetes. Her baseline HbA1c was 15.1. She also reported severe diabetic neuropathy in the feet, which was treated with gabapentin. In the upcoming slides, we will further explore how the plant-based dietary modifications in managing diabetic neuropathy is effective.
Thank you. I'm continuing with the results. So, two major factors have been identified behind the pathophysiology or the development of peripheral neuropathy in diabetes. One is there is decreased endothelial production of nitric oxide. There is occlusion of the vasovasorum near the nerves, increase in blood viscosity. These factors were found to contribute for the hypoxia or impaired perfusion in patients suffering with diabetes, leading to peripheral neuropathy. And there have been identified some modifiable risk factors, that is poor glycemic control, increased blood pressure, cigarette smoking for a duration of more than 10 years or so, and dyslipidemia with increase of triglycerides, etc. are the possible risk factors which can be eliminated with the help of plant-based diet. So several studies have been cited in this RCT. Next slide, please. Several studies have been identified to have a positive effect in elimination of these modifiable risk factors in diabetic people. That is, who have followed low-fat plant-based diet. They had improved insulin sensitivity and better glycemic control. And also, over a period of time, their HbA1c levels were found to be less than 6. Then the two studies which already have been discussed earlier, the Crane and Simple study and Burner study. In them, there are two important points which have been identified to be important in decreasing peripheral neuropathy symptoms in patients. One is the good glycemic control. It was observed following 10 days of the plant-based diet, and there was a reduction in pain significantly just after 4 days of following the vegan diet. and decrease in weight and blood pressure was observed in these patients. Next slide. Yes. Similar findings of decrease in weight and decrease in blood pressure was observed in a study done by Bunner and his colleague. It has been stated that decrease in blood pressure and weight reduction might be the contributing factors which are giving a synergistic effect in significant improvement of the symptoms of pain or tingling sensation or numbness in patients of diabetics. But there have been some drawbacks in both these two studies, the Cranon sample study and the Bunner study. Both did not actually tell the exact molecular mechanisms behind the action of how the plant-based diet is actually making this happen, the reduction of symptoms of the peripheral neuropathy. And also, Cranon sample study is also lacking a control group. It has taken just one group and it has followed. And if you take Bunner study, they have a control group. Next slide, please. McCarthy had suggested that in Cranon simple study, the decrease in the symptoms of peripheral neuropathy might be because of the improved blood rheology. That is nothing but decrease in blood viscosity might be the mechanism behind the analgesic effect. Next slide. There have been some other studies apart from Cranon sample and Bunner study. A 2014 meta-analysis has indicated that adhering to a plant-based diet resulted in a statistically significant lower HbA1c levels among participants from the vegan diets. And also, several studies identified that modifiable risk factors, as you have already mentioned, the glycemic index, blood pressure, dyslipidemia, the modifiable risk factors of diabetic peripheral neuropathy, they have been ameliorated by plant-based diet. But there have been some limitations also to all these studies. They have established the role of lifestyle modifications alleviating the symptoms, but studies specifically elaborating on the exact mechanisms of how the plant-based diet is working is lacking. Thank you. And my fellow, they will follow.
Hello. Thank you, Dr. Sandhya and Dosna, for just briefing the supporting articles on diabetic neuropathy. So, as we know that the good nutrition is often the first line of defense to avoid many of the diseases, including these conditions. So, these are the factors. That is the decreased endothelial production of the vasodilator nitric oxide. And the other factor is an increase in the blood viscosity constituting an unfavorable rheological change. So these are the contributing to the impaired perfusion and the peripheral nerve hypoxia in the diabetic patients. So how we can manage? So that we need to be carefully manage these conditions. One is the best way is we need to adapt or we need to optimize our diet. That is the whole food plant-based diet is being effective in managing these conditions. And here is a supporting article that is studied by Smith and his co-workers in 2019. That is the whole food plant-based diet may improve these conditions and restore the ability of the endothelial cells to produce the nitric oxide. So as we are all familiar with the glycemic index, so similarly, the Bran and the Loscalzo that they have introduced the nitric oxide index. So this is a useful tool for the people in managing the diabetes health, and also the people who has a vascular disease or any conditions which are associated with the nitric oxide insufficiency, they can follow this nitric oxide index. So this is the formula that is nitric given here, which incorporates that both nitrite and the nitrates foods, the dosages in the food, as well as this ORAC is what the oxygen radical absorbance capacity of those foods. So why? Because it's taken up as why? Because one is that is the free the oxygen free radical reduction happens, that which in turn prevents the scavenging of the nitric oxide. Along with that, it is going to enhances the in vivo chemical processes that generate the nitric oxide. So in this study, what they have given is these vegetables are the major sources of the nitrates, and the single plates of green leafy vegetables are going to they have more nitrate in the form that endogenously over an entire day. So here in this study, they have like 500 gram per day of green leafy vegetables, which are slightly cooked whole, rather than giving in a form of a smoothie or anything. Okay, why? Because we know that the reduction, or we can say that the nitrates going to reduce to the nitric oxide, there is a lot many process are there. So the multiple process that is going to allow the effective reduction, that is from the inorganic nitrates to the nitric oxide. Why? So when we chew it, whatever the bacteria which are present in the mouth or the tongue, it is going to combine with that. So there will be an effective reduction happens. So that's why they have given like a slightly cooked whole form of these vegetables, that is green leafy vegetables. That is 6 servings of these green leafy vegetables a day they have served in the study. So these are the highest nitric oxide index score. That is the highest we can see in the wild radish, and the broccoli is having a 122. Yes, ma'am. So coming to the, we know that the hemorrhagical parameters in the diabetes mellitus, it is oftenly like it is disturbed. So like erythrocyte aggregation happens, or the RBC deformability, that is a less flexibility will be there. And these are all associated with each other, so that it is going to increase both plasma as well as the whole blood viscosity, what we call it as a hyperviscosity. So these abnormal, the hemorrhagy and this hyperviscosity of this blood. So the combination of this, due to the combination of the metabolic or the cellular or the biochemical changes, which have chronic hyperglycemia or the hyperlipidemia, it is going to impair the microcirculatory flow in patients who are all who are diabetic, and also finally it is going to contributing to the endoneural system. So there are the studies. Yes, ma'am. There are the studies which is date back, which is studied, that is in 1986, as well as the recent one is 2018. They have studied on the rheological parameters, like how the diet actually is going to impact on the or the influence the blood rheology. Okay, that is we can see these studies, they showed that the plant-based diet is going to improve the blood viscosity and the filterability. And also the Baghdad and the co-workers which they have studied, so they have showed a result, showed that here we can see the result, the table form, and that is the regular consumption of this simple vegetable soup. That is the diet regime is for the for 6 weeks. So it is consisted of like again the daily consumption, it is has been determined based on their BMI and all. So they have given like 300 gram per day of this one, based on their BMI. So which showed that we can clearly notice, I have which has been highlighted there, it is going to influence, notice that how the vegetable soup has influenced on the blood viscosity. That is the significant influence we can see, both the intervention, that is before and the after intervention, we can see that there is an improvement in the blood viscosity. Yes, next. Yes. So by this, we can say that the diet has a role in restoring the blood rheology. That is the whole food plant-based diet, which we saw that there is an improved hemorrhagy and also the optimized intake of these antioxidants. That is, we know that the vegetables and the fruits and all, they have the rich in antioxidant, and also there is an important nutrient such as nitric oxide and also the magnesium. These complementarily contributing to the improved blood flow in the endoneural microvasculature. So, but nowadays they are focusing on, or the emphasis is given even on the role of how this inflammation on the diabetic neuropathy is happening. So here is we can see the picture over there. So there are many pathophysiological factors which are responsible for the diabetic peripheral neuropathy. The studies which showed that this chronic low-grade inflammation, that is one of the critical pathway for this development and also the progression of these diabetic peripheral neuropathy, and also which gives an inflammatory environment in the type 2 diabetic patients. So clinically, if we see that this low-grade inflammation, that is whatever the inflammatory molecules we can see in the figure. So that is these low-grade inflammation is marked by the increase of these inflammatory molecules like a pro and the anti-inflammatory cytokines concentrations or the other biomarkers that activate the immune system. So which in turn, again, it increases the risk of atherosclerosis and type 2 diabetes. Next one. So how we need to manage, how we need to manage the inflammatory, how we need to reduce these inflammations. So in that case, the Hua and the Wrong 2016, they have studied how these dietary polyphenols, which are present, that is mainly from the plant-based diet. So how is going to affect how these dietary polyphenols helps in reducing these oxidative stress or the inflammations. So there they have categorized or grouped into the 7 categories. We can see that the even the polyphenols they have mentioned. So the 7 category, one is that promote the cell proliferation. So vitamin E and all that is going to promote the cell proliferation and also promote the activation of glial cells, so that which is present around the neurons and all, so which is going to supply the nutrients. And also it's going to help in the regulation of these calcium ions and maintaining the nerve cell structures. And also these polyphenols is going to provide resistance in the to the oxidative stress. And also finally it reduces the inflammation. So that so this is how it is going to what the single even the particular polyphenols have their own role in maintaining the, or we can say it is a neuroprotective effect. Next one. So as I said, even the magnesium is one of the major nutrient. So magnesium and also the hypomagnesium is a one condition we see in the diabetic patients, type 2 diabetic patients. So while the magnesium is essential for the proper inositol transport, that is, which is crucial for the nerve function and also the signal transmission. So the magnesium, if the depletion of these if the depletion happens, where there is a significant, again, there is a progression of diabetic, the complications also occurs. So we need to balance these magnesium status so that we can reduce these microvascular as well as the macrovascular complications. So aligning to that, the study which is published in the International Journal of Medical Biochemistry 2019, they have observed that the that is, we can see here the graphs, the line graph, no, which showed that significant negative correlation between the magnesium levels and the glucose, HbA1c, and the HOMA-IR values. So because these magnesium, as I said, plays an important role even in the glucose and insulin metabolism, so that it regulates the entry of these glucose into the cells and it is going to give like the food to the cells and all. And also the sum of the factors like changes in the insulin metabolism, what happens, like changes in the insulin metabolism and also the factor like the poor glycemic control and all, these are going to lead to the decrease of these magnesium levels. So that we can see here in the figure, which is circulating, that is how the diabetic mellitus is going to, the magnesium deficiency going to, that increase in the glucose, decrease in the glucose utilization happens, increase in the insulin resistance happens. So again, it is going to increase this progression of these complications, which is again leads to diabetes mellitus and all. So that there is a excretion will be more. So that we need to balance the magnesium, by which the magnesium, we can take the magnesium rich foods, which has shown that the beneficial for the diabetic patients, which is going to reduce these magnesium conditions. So these are greens, nuts, seeds, dry beans, the whole grains and the wheats and all. These are the magnesium rich foods there the diabetic patient can take. Yes. So in the further slides, Dr. Sindhura is going to explain the detail or discussing these factors and all. Yes. Over to you, ma'am. Thank you.
Thank you so much, Preetham. So firstly, I would like to start on with the discussion with an important note that the number of studies that were done in this particular field with relation to plant-based diet and diabetic neuropathy are very limited. But whatever the few studies were there, they have given a very promising results that plant-based diets are can really help in ameliorating the symptoms of the diabetic neuropathy. So hence, so let's delve into the discussion part. So just a quick recap. Already my colleague Dr. Dharani has already explained a little bit about the diabetic neuropathy. So if you talk about the diabetic neuropathy, it's a neurodegenerative disorder which is going to impact the peripheral nerves. And most importantly, this is one of the common complications of the diabetes, which can affect almost 50% of the diabetic patients. And mainly, the research has suggested that the hyperglycemia is one of the promising factor that can lead to the development of the long-standing hyperglycemia, can lead to the development of diabetic neuropathy. And whenever there is long-standing hyperglycemia, it is going to target the Schwann cells in severe cases, which can lead to demyelination. So if you look at some of the factors like unhealthy food habits, sedentary lifestyle, obesity, and all these things can affect or worsen the insulin resistance and lead to hyperglycemic conditions. And when there is hyperglycemia, it can lead to the release of the inflammatory mediators and hyperactivate the signaling cascades, which is going to lead to axonal degeneration, and that is going to lead to diabetic neuropathy in short. So if you look at the prevalence of the diabetic neuropathy, so around 66% of the type 2 diabetic patients have diabetic neuropathy, and 59% of the type 1 diabetic patients have diabetic neuropathy. And if we talk about the Indian prevalence, 18 to around 62% of the type 2 diabetic patients have diabetic neuropathy. And overall, globally, if you look at the population, 50% of the diabetic population are affected with the diabetic neuropathy. And as I've already mentioned, the major indicators of the diabetic neuropathy, it includes the duration of the hyperglycemic state, for how long there is hyperglycemia, and also the level of the HbA1c. In addition to these, some of the factors that affect the onset and the severity of the neuropathy from diabetes are like the sedentary lifestyle, the consumption of alcohol, smoking, obesity, high cholesterol levels, and hypertension. And some of the factors that leads to this diabetic peripheral neuropathy are the oxidative stress, the constriction of the blood vessels supplying the peripheral neurons, and the inflammation in the nerves. So this diabetic peripheral neuropathy, it begins bilaterally in the toes, giving out the stocking-glove distribution. And after developing sufficiently in the lower extremity, it's going to affect the higher limbs as well. So chronic hyperglycemia being the significant contributor for the macrovascular and the microvascular consequence of the diabetes. So when this diabetic neuropathy develops, it leads to a decrease or loss of peripheral nerve fiber function, which is followed by hyperalgesia. That means pain, which is exaggerated with respect to a standardized noxious stimulus, and allodynia, which is the pain which occurs on touch. And if you look at the pathomechanism, usually first the sensory neurons will be affected, later the motor neurons will suffer damage later on. And some of the common or frequently encountered symptoms in the diabetic neuropathy are the numbness, the sensory loss, the paresthesias, and the extreme pain at night, which keeps the patient awake. As we have already discussed, one of my colleagues have already mentioned, the three most important factors that can lead to the occurrence of the diabetic neuropathy are the hyperglycemia, hyperlipidemia, and the inflammation. All these three conditions, what exactly they're going to do is they're going to lead to increase in the neuronal cell apoptosis, reduce in the neuronal cell survival, decrease in the regeneration, and decrease in the reinnervation, which is going to lead to the diabetic neuropathy and the respective changes, like in changes in the pain perception. It could be pressure, cold, heat sensations, and it can also lead to autonomic vascular, renal, and retinal neuropathy. So coming to the management part, so with respect to the management part, the medical management is equally important. In addition to that, the patient education, particularly on the food self-examinations and the strict glycemic control, can be a cornerstone in the management for the diabetic neuropathy. And for a better management, some of the important lifestyle changes are quitting smoking and having a proper nutritious diet and exercising. All these are important for the better management of the complications of the diabetes, specifically diabetic neuropathy. So recently, the plant-based nutrition is receiving the broader attention in the medical community, and there is now considerable evidence that a plant-based diet is a powerful tool in the prevention as well as in the management of the type 2 diabetes. And a plant-based diet can exert beneficial effects not just with pertaining to diabetes, and also with respect to the other lifestyle disorders like hypertension, obesity, and all those things. As such, tackling diabetic neuropathy, one of the most prevalent complications of the diabetes, with a plant-based diet can definitely be a reasonable strategy. So when we talk about a plant-based diet, what kind of a diet do we have to include? So this particular picture summarizes everything very much beautifully. So first thing, eliminate the animal products from your diet, limit high-fat foods, try to fill up more your meal plates with a fiber, and try to include low glycemic foods, because low glycemic diet really helps in better management, and then supplement with vitamin B12. So considering all these 5 pointers can help in better meal planning as well as a better management in the diabetic neuropathic condition as well. And the current review examined how vegan and plant-based diets performed in clinical studies in individuals suffering with diabetic neuropathy and whether they constitute an effective treatment option to reduce pain and other symptoms or not. So gladly, the participants noticed reported a partial or a complete relief of the neuropathic pain, and they were also able to reduce their daily medication, which is a phenomenon that has been consistently observed in the type 2 diabetic patients when they follow the plant-based dietary interventions. Considering these findings, we can say that a plant-based diet can help alleviate pain in diabetic neuropathy, while not only just alleviating the pain, it also helps in improving the glycemic control. Even the lipid profile also can be managed well, and also it helps to lose weight as well at the same time. So it's like a jackpot. It's going to help you in alleviating the pain as well as improving your other metabolic parameters as well. So in the current studies that we discussed in the systematic review, the dietary recommendation, not just the dietary recommendations, they were also paired with some of the important lifestyle approaches and supplemental factors like adequate sunshine and recreation. So what they noticed is when an individual or a type 2 diabetic patient is undergoing regular supervised aerobic exercise, it can lead to significant reduction in the pain or the neuropathic symptoms, because it leads to increase in nitric oxide bioavailability, which can improve the endoneurial blood flow and subsequent peripheral nerve hypoxia. And not only that, when we follow plant-based diet, which is low in saturated fat and free of cholesterol, it can help in improving the blood viscosity, and that can improve the arterial flexibility, which leads to better blood flow that can prevent endoneurial ischemia as well. But again, it was difficult to determine which part of the intervention the Crane study promoted the respective clinical improvements. Is it the dietary one or the other lifestyle approaches? But the fact in the Burner and colleague study, where they did not require patients to exercise regularly, but still they were able to find the results. So which indicates that a favorable indication that plant-based diet can help in alleviating or reducing the symptoms of the diabetic neuropathy. So when we talk about the management part, if we talk about the plant-based diet and the management of the diabetic neuropathy, some of the most pointers that we need to be focusing on, first thing is nitric oxide. So the importance of nitric oxide for diabetics is the nitric oxide is going to increase the vasodilation, which is going to increase the delivery of the essential oxygen and the nutrients. Not only that, the nitric oxide production, the normalized nitric oxide production can help can directly impact the nerve function by improving the nerve membrane permeability. And also the nitric oxide production can mitigate the pain, because nitric oxide is going to mediate the analgesic effect of opioids by increasing the CGMP. So here are some of the nitrate-rich foods or nitrate sources, basically your beets and beetroots and the green leafy vegetables. So here the respective dosage of the nitrate content is available. So again, in the nitric oxide, if we talk about, it can be because of the arginine pathway and the dietary pathway. In the arginine NOS pathway, it might not be so efficient in diabetics, because diabetes is a kind of acidic state where NOS might not be working efficiently. So hence, it's always good to get as much dietary, nitrate from the dietary source as much as possible. And here you can see the nitric oxide through the CGMP pathway. It can help in leading to the vascular smooth muscle relaxation, inhibiting the platelet aggregation, and increasing the vascular permeability. So it might be actually legitimate to recommend a plant-based diet based on this. that induces weight loss while being high in fiber, important rich in micronutrients and nitric oxide rich components that have shown favorable effect on diabetic neuropathy. And foods with a low glycemic index are also equally important to manage the neuropathy, because a low glycemic diet can help in better management of the diabetic condition, which can lead to better glycemic control, and that can help in better management of the neuropathic symptoms as well. So some of the examples of the low glycemic index foods like whole grains, legumes, nuts, seeds, and non-starchy vegetables. So first factor is nitric oxide. The second factor what we need to be focusing on is weight loss. So for that weight loss, in this particular study done by Crane and Sample, they included caloric restriction for almost all the participants, where they were restricted to about 1200 kilocalories per day. And they have seen a substantial weight loss, which can bring about significant improvements or even remission of type 2 diabetes. Therefore, it appears that weight loss played a crucial role in the improvements in the metabolic control, as well as in ameliorating the neuropathy symptoms in the study participants. And a recent randomized control trial of 5 different diets indicated that vegan diet or plant-based diets can result in greater weight loss than more modest dietary recommendations. And another recent study by Mr. Bernard and colleagues revealed that a low-fat vegan diet and a portion-controlled eating plan can lead to comparable clinical improvements in the individuals with type 2 diabetes. Now, if in a simple way, if we talk about how plant-based diet can help in better weight losses, if we talk about whole food plant-based diet, it is pretty much nutrient dense and low in calories. So that can help in a comfortable way of achieving the caloric deficit, which can help in weight loss. And when there is a weight loss, we can see definitely an improvement in the insulin sensitivity and a better glycemic control, which can lead to the reduction in the complications of the diabetes as well. So one is nitric oxide, the other one is weight loss. The third one is the anti-inflammatory effects of the plant-based diets, which can help in reducing the inflammatory changes in the diabetic neuropathy. So how can we achieve that particular effects is by including omega-3 rich foods like walnuts, flax seeds, chia seeds, etc. And including more of green vegetables and green leafy vegetables and spinach, broccoli, kale. They contain a specific micronutrient called as alpha-lipoic acid that can prevent the nerve damage and improve the nerve function. Likewise, try to include more of berries, peaches, cherries, oranges, watermelon, and all those things which are loaded with antioxidants, which can help to reduce the inflammation and reduce the nerve damage as well. So these grapes, blueberries, and cranberries, they also found to be even more powerful anti-inflammatory because of a compound called because of the presence of a compound called as resveratrol. And quinoa is also a great source of potassium, and avocado is also contains a healthy dose of potassium, which can help in better nerve, which can promote a better nerve conduction as well. The fourth one is magnesium. So magnesium plays a key role in regulating the insulin action and insulin-mediated glucose uptake in the vascular tone. So if we look at what happens in the magnesium deficiency. So when there is a magnesium deficiency, it leads to the low-grade inflammation, increasing the oxidative stress, cytokines, and the circulating CRP. And not only that, magnesium deficiency impairs the insulin signaling cascade and the glucose tolerance, which can put us at a risk of landing up in type 2 diabetes or worsening our glycemic control. So when there is magnesium deficiency in diabetic condition, it can also increase our risk of landing up in the complications. And by including the magnesium, dietary magnesium or the magnesium-rich foods, as you can see in this image here, the various magnesium-rich foods like hemp seeds, pumpkin seeds, zucchini, all the green leafy vegetables, beans, flax seeds, squash, sauerkraut, and all those things, the magnesium basically it shows the effects of anti-apoptosis, antioxidation, and anti-inflammatory, which is of a great significance for nerve impulse conduction. And not only that, appropriate concentration of magnesium in the tissue can promote squam cell proliferation as well as its synthesis. So even if you look at the magnesium functions, the magnesium is going to help in it's going to help in antihypertensive and anti-inflammatory functions. It can act as a natural calcium antagonist, which can help in prevention of coronary vasospasm. It enhances the endothelium-dependent vasodilation. It acts like a cofactor in mitochondrial oxidative reactions, and it acts like an anticoagulant and antiplatelet properties, and it helps in improving the glucose and insulin metabolism as well as the lipid profile as well. So fifth one is the flavonoids. So flavonoids are a class of metabolites that are found in fruits, vegetables, grains, roots, stems, flowers, teas, and wine. So they're divided into, again, flavonols, flavones, anthocyanidins and isoflavonoids and all. So basically, they play an important role in diabetic neuropathy, as shown in several in vitro, in vivo, and some human studies as well. If we talk about the various flavonoids that I'll be showing in the later part of the slides, are some of them are chrysin, diosmin, hesperidin, camphorol, quercetin, rutin. So they have this antioxidant, anti-inflammatory, and anti-amyloidogenic activities that protect against the diabetic neuronal cell death and dysfunction. So if we look at the chrysin, it's a naturally occurring flavone that's found in honey, fruits, and vegetables, which shows a protective nature against the neuroinflammation, in addition to the antioxidant, antidepressant, and anti-amyloidogenic effects. The other one is diosmin, which is obtained via the dehydrogenation of hesperidin, which is usually available in the citrus fruits. That again leads to anti-inflammatory and anti-hyperglycemic effects as well, anti-hyperlipidemic and antioxidant properties. The other one, the most famous one, is EGCG, epigallocatechin 3 gallate, which is usually available in the green tea. That can again, it is responsible for the beneficial antioxidant effect, and it also showed the neuroprotective activity against the oxidative damage and the neurodegeneration. And if you look at camphorol, which is usually available in the cruciferous vegetables, grapes, strawberries, and all those things, it also has shown a lot of anti-diabetic and neuroprotective effects as well. And luteolin, which is available in parsley, sweet peppers, and celery, it also has shown the neuroprotective effects. And naringenin, which is usually available in the citrus fruits, it has shown a decreased diabetic neuropathy conditions as well. And the quercetin, which is available in onions, apples, broccoli, and tea, it has also shown various anti-diabetic effects as well. So these are some of the flavonoid examples that are available in a lot of plant-based foods, which can show antioxidant, anti-inflammatory, neuroprotective effects, as well as the anti-diabetic effects and the improving the lipid profile as well. Likewise, if you look at the vitamin A as well, from one of the studies, they are able to notice that the retinoic acid has been shown the effects of the potential therapeutic agent for the treatment of nerve degeneration and dysfunction diabetes. And vitamin D also, in one of the study where they have given this vitamin D supplementation again to about 51 type 1 diabetic subjects with painful diabetic neuropathy, and 50% of them has mentioned there is a decrease in the pain scores. Likewise, vitamin E, specifically the alpha tocopherol, it has beneficial effects against the diabetic neurocytotoxicity. And a study of type 2 diabetes mellitus patients, 88% of the study population, they reported relief from the neuropathic pain as well after the supplementation with vitamin E. This is one of the beautiful paper which is talking about the bioactive compounds and how they can ameliorate the diabetic complications. So the link of the study is mentioned here. And finally, it is also important to note that Banner and colleagues used a vitamin B12 supplement in one of their studies, which could also might be the one imparting the effects of reducing the symptoms of the diabetic neuropathy. But again, on the other hand, there is also another review which found no evidence with respect to the oral vitamin B12 supplementation. There was no improvement in the diabetic neuropathy. So if we come to some of the limitations of this study, so this study, the studies considered in this review, they were not only like completely plant-based, they have some other factors also involved in it, like exercise supplemental factors. And the another limitation from this review is that despite plausible inclusion-exclusion criteria as well as a wide search strategy, some articles published in other databases than PubMed and Google Scholar could have been potentially overlooked by both the reviewers. So if we if we have to sum it up overall, as I've already mentioned in the starting, though the number of studies were limited in this particular concept of plant-based diets and on this topic of plant-based diets and diabetic neuropathy, but definitely the studies have shown some promising results. So if we want to sum it up, what are the factors to be focused on? One is nitric oxide, the other one is magnesium, the other one is the polyphenol, the flavonoid compounds that are present in the plant-based diets, and most importantly, how the plant-based diet can help in better weight loss, and that can help in improving the insulin sensitivity and improving the glycemic control as well. So these are some of the things that we need to be focusing on. So now the conclusion part will be taken over by my colleague Srinidhi. Srinidhi, you can take over, please.
Thank you, ma'am. So now let's sum up and conclude what this study, this particular systematic review, has to say about plant-based diet and diabetic neuropathy. Next slide, ma'am. So a plant-based diet may help alleviate pain in diabetic polyneuropathy, also significantly improving glycemic control, which is very crucial for managing diabetes, helps with weight management, and improves serum lipid profile, which is vital for cardiovascular health. And one significant benefit of plant-based diet is the potential to reduce the medication burden for diabetes patients. This means we take fewer medications, which can lead to fewer side effects and lower healthcare costs. Next slide, ma'am. However, the evidence supporting the benefits is limited. This systematic review found only 2 clinical trials, and one of them had an uncontrolled design. There's also lack of studies examining the molecular mechanism behind these benefits. However, the study has proposed several mechanisms for the benefits of plant-based diet in diabetic patients. These include improved glycemic control, better management of risk factors, improved hemorrhagiology, that is blood flow properties, and optimized intake of antioxidants and nitric oxide. These factors together might improve the blood flow in the endoneural microvasculature. This improved blood flow in the endoneural microvasculature can reduce local hypoxia, which in turn can alleviate pain. So this improved circulation is one of the key proposed benefits of a plant-based diet in diabetic neuropathy. Next slide, ma'am. So the study by Crane and Sample included patients with severe painful systemic distal polyneuropathy. These patients experienced a very rapid improvement with a plant-based diet when even standard treatments had failed. So now, given the potential benefits and limited current evidence, it is crucial to conduct more research into the molecular effects of a plant-based diet. Larger clinical trials are needed to validate these findings and also explore the full potential of plant-based diet in diabetic neuropathy management. Next slide, ma'am. In conclusion, while the evidence is currently limited, the potential benefits of plant-based diet for managing diabetic polyneuropathy are promising. More research is needed to fully understand and confirm these benefits, and this approach could offer a very cost-effective and side-effect-free option for patients suffering from diabetic neuropathy. As we move forward in the fight against diabetes and its dreaded complication like diabetic neuropathy, it is crucial to explore every possible avenue for relief and improvement. A plant-based diet, as we have been discussing over this entire session, offers a very promising, cost-effective and side-effect-free approach that could transform the lives of many patients suffering from diabetic neuropathy. So let's commit to further research and give this potentially life-changing intervention the attention it deserves. So the future of diabetes care could very well be on our plates. Thank you, ma'am. Over to Sindra, ma'am.
Thank you. Thank you so much, Srinidhi, for that beautiful conclusion. And this completes today's journal club session. And please do let us know in the chat box how you felt about today's session. Was it insightful? And if you have any queries, we would love to answer them. Please do drop them in the chat box. And and let me tell you, we are also coming up with another interesting session, that is how gut health and the microbiota, how the plant-based diet can affect the gut microbiome, and how that is going to affect the diabetic management as well. So that is going to be an interesting topic that will be coming up in June on 12th. Okay. So please do let us know. Please give us your valuable feedback in the chat box. That can be really helpful. And any queries, please do let us know. And thank you so much for taking out time from your busy schedules and attending today's session.